Hi friends. So we are going to start with a new topic in the cardiovascular system, and that is antihypertensives. So antihypertensives, as the name suggests, are the drugs that are used to treat hypertension. And what is hypertension? When there is increase in the blood pressure. Now, hypertension can be, primary or secondary. Primary or essential hypertension का मतलब होता है कि there is no, identifiable cause, no apparent cause. So that's called as the primary hypertension. Secondary hypertension means that the hypertension जो है it is secondary to some other cause. For example, किसी को kidney disease है या Cushing's syndrome है, ठीक है, जहाँ पे adrenal, या स्टेरॉइड्स बहुत ज़्यादा है या एरिटल कॉर्टिकॉइड्स, ठीक है. सो फियोक्रोमोसाइटोमा में कैटेकोलामीन्स बहुत ज़्यादा हैं, सो दे आर कॉजिंग द राइज इन द ब्लड प्रेशर. So or sometimes there is high renin activity because in the kidney disease या कुछ भी है that is leading to increase in the blood pressure. So it is secondary to a cause, that's called a secondary hypertension. Primary means there is no actually identifiable cause. तो कोई ऐसा cause नहीं है, कोई disease नहीं है, but there is hypertension which can be because of so many factors, lifestyle factors हो सकते हैं. Now हाइपरटेंशन को क्लासिफाई हम कैसे कहते हैं कि व्हाट इज हाइपरटेंशन. से हमें पता है कि हमारा ब्लड प्रेशर नॉर्मल हम कहते हैं 120/80 मिलीमीटर ऑफ मर्करी, ठीक है. 120 इज द सिस्टोलिक ब्लड प्रेशर, डायस्टोलिक इज 80. बट जो JNC जॉइंट नेशनल कमेटी 8th ने जो क्राइटेरिया दिया है कि हाइपरटेंशन को, वेदर इट इज स्टेज 1 स्टेज 2 दैट इज डिफरेंट, बट हम हाइपरटेंशन उसको कहेंगे when the systolic blood pressure is either greater than or it is equal to 140. So if it's 140 or more and just diastolic it is 90 or more, that is said to be hypertension. तो उससे पहले it's like pre-disease stage, not called as hypertension. अगर ये है कि इसको हम 140 के बाद ही we'll categorize into different stages. And whenever we want to treat the milder cases, or you can say which is the blood pressure is not 140/90 yet, but yes, they are approaching that particular mark. So we can offer patients various lifestyle modifications rather than going for the drugs itself at that very point, ठीक है. जैसे अगर कोई उसकी lifestyle में sedentary lifestyle है, exercise हम इसको advise कर सकते हैं, या a lot of high pressure, high tension, high stress job है, so maybe he can do something which is not as stressful. और whether he is taking high sodium in his diet, salt intake बहुत ज़्यादा है, especially जो हम table salt ऊपर we pour, one which is cooked it's okay, but when you ऊपर से डालते हैं हम salt, that is more dangerous. Table salt ऊपर से डालते हैं, so that can be avoided in the dietary restrictions. Then smoking, alcohol, all these kinds of factors जितने भी होते हैं, that can be avoided. So initially we should start with the lifestyle modifications, and when we go to the later stages, then drugs come into picture. But lifestyle modifications stay, they are always there, but drugs are added at a later stage when only lifestyle modification is not able to take care of the blood pressure, rise in blood pressure, then we add the drugs. But ऐसा नहीं कि drugs देंगे and lifestyle modification नहीं करेंगे. No, lifestyle modifications continue along with the drug therapy. Now, before I go into the drugs, we will see that how your blood pressure is regulated. We've already done, you must have done it in the physiology beforehand. Just a revision of what happens. How is your normal blood pressure in the body regulated? What are the mechanisms? So, see, for example, you're lying down and suddenly you are getting up. तो क्या होता है कि जब आप लेटे हो और बैठ के उठते हो, so your venous return is decreased and your cardiac output is decreased and your blood pressure is decreased. So ideally you should have a fall in BP and faint or fall down, but ऐसा होता नहीं है. Why? Because your body के regulatory mechanisms होते हैं, they will increase the venous return, they will increase the heart rate, and they will cause the cardiac output to maintain and the BP is maintained. So these are the various mechanisms in your body which function, how your blood pressure is regulated in the body. Right? So these are there are 3 important points here, that we have a baroreceptor mediator. This is one of the most important mediator of your blood pressure, the baroreceptor system, which actually keeps your sympathetic nervous system in check. Then we have the renin, angiotensin, aldosterone system. So I've already explained in detail about the system in the lecture on the drugs acting on the RAS. And thirdly, we have certain local factors which are released. For example, nitric oxide is released from the endothelium. It is a vasodilator. Then there are certain substances like endothelin 1, which is a vasoconstrictor. So what happens in certain patients that, the nitric oxide is not synthesized as much, or the endothelin is much more in quantity, so that can give rise to a high blood pressure. That's another factor. Now let's see how they are regulated in the body. See, so this is what happens is, this is the baroreceptor, and this baroreceptor normally keeps your sympathetic nervous system in check. ठीक है, जब ये active होता है तो sympathetic nervous system is always in check. There is no undue or unwanted release of the catecholamines so that they are going to rise the BP. No, it doesn't happen that way, right? And remember, your blood pressure is a product of cardiac output into total peripheral resistance. So anything out of this will rise, your BP will rise. So whether it is your cardiac output or whether it is your peripheral resistance, they are going to rise. And your cardiac output, it governs your systolic blood pressure. Okay? So whatever, when your ventricles are contracting, right, they are in systole, they are going to push blood into the aorta. ठीक है, they are going to push blood in the systemic circulation in the aorta, and that pressure जो systole के time पे वो generate करता है into the aorta, that is the systolic blood pressure. While उसके बाद जब pump हो गया blood, the blood has gone into the circulation, it is going down into the systemic circulation. Now it has to enter into the arterioles and in the capillaries and then into the veins. So when the ventricles now relax, ठीक है, so whatever pressure is maintained in the vessels, that is a diastolic blood pressure. So it mostly depends upon जो आपके blood vessels हैं, जो peripheral blood vessels हैं, उनकी resistance पे depend करता है. So the diastolic blood pressure depends on the peripheral vascular resistance. If there is high resistance to the flow of the blood, the pressure is going to be high. If that means if there is constriction of the arterioles, the peripheral resistance is going to be high. If there is dilatation of the arterioles, the peripheral resistance is going to be less, the BP is going to be less. और अगर normal है, so जो हमारा normal blood pressure है वही रहेगा. So just remember, your cardiac output is responsible for systolic blood pressure. Your total peripheral resistance is responsible for your diastolic blood pressure. Anything which varies, which is going to affect these two factors, are going to affect the blood pressure as such. So let's say what happens when there is a decrease in the BP. As I said, कि जब a person gets up, from he's lying down and gets up suddenly, what happens? This baroreceptor जो trigger है, that is stopped. ठीक है, तो फिर ये नहीं रहेगा. There is no act. It is going to, because BP is less. So what will happen? There will be inhibition. This is going to be inhibited because baroreceptors will sense that there is a decrease in the blood pressure because there is a decrease in the cardiac output. So this inhibition is no longer going to be there. So sympathetic nervous system gets stimulated. So when the sympathetic nervous system stimulates, there is release of noradrenaline. Catecholamines are released and they are going to act on the receptor, whether it is the alpha or the beta receptors. Okay? So firstly, what happens when it acts on the heart? On the heart, we have mainly the beta 1 receptors. It is going to increase the heart rate and it is going to increase the force of contraction. So because of the force of contraction, there is going to be increase in the cardiac output, and I told you if anything increases the cardiac output, the blood pressure therefore is retained. Dusra, there are beta 1 receptors present in the JG cells on the kidneys, right? So they are present on the kidneys, JG cells. Beta 1 is stimulated and this leads to release of renin, and we know that renin converts angiotensinogen into angiotensin 1, and this angiotensin 1 with the help of ACE enzyme is converted into angiotensin 2, and this is a potent vasoconstrictor. So it is going to constrict the venules and the arterioles and everything. So it is going to again increase the preload and it is going to increase the afterload. So when arterioles are actually constricted or the arteries are constricted, it's going to increase the afterload, and preload may venule, so therefore it's going to increase the total peripheral resistance. Okay? That is, it is going to increase. So again, anything which increases the total peripheral resistance is going to increase your blood pressure. Then it has effects on the alpha receptors also as such, and they are also going to cause the vasoconstriction. So all these effects, ठीक है, so all these effects, alpha receptors actually they are going to cause the vasoconstriction. So all these effects ultimately they try to increase the blood pressure in the body. ठीक है, so ये सारा क्यों हो रहा है? बिकॉज आपका बीपी फॉल, बिकॉज ऑफ एनी रीजन जब फॉल इन बीपी है, ये सारे आपके जो रेगुलेटर्स हैं बॉडी में, बेरो रिसेप्टर्स है, देन रेनिन रेगुलेशन है, देर ऑल ट्राइंग टू इंक्रीज द ब्लड प्रेशर इन योर बॉडी. सो दिस इज हाउ योर ऑटो रेगुलेशन ऑफ ब्लड प्रेशर अकर्स इन द body. Then there are circulating जो nitric oxide and that is separately done, and because sometimes there is certain triggers which are releasing the nitric oxide, certain triggers releasing the endothelin, so the PP would depend on that, because it is said that when you like patients who are on high sodium diet, जिनको सोडियम बहुत ज़्यादा होता है, that causes high blood pressure. Why sodium causes high blood pressure? Because sodium leads to one is it is going to increase the vascular जो smooth muscles है. If there is sodium, so वो क्या करेगा, जो smooth muscles हैं, let's say this is the vascular smooth muscles, it is going to cause the contraction. It increases the contractility of the vascular smooth muscles because of a pump. There is an exchanger here, sodium and calcium exchanger present होता है. Depends on the concentration of sodium and calcium. तो जब sodium concentration हमारी body में ज़्यादा है, it is in the cells, it is high concentration, so more sodium tries to go out of the cell, and then इसके exchange में calcium will come into the cell. And calcium क्या करता है? It is important for the contractions. So it is going to increase the contractility of the vascular smooth muscles, so that it causes high BP. That is the number one ways. Number two way, what sodium does, it decreases the synthesis of nitric oxide, and nitric oxide is a vasodilator. So if it decreases the synthesis of nitric oxide, again there can be vasoconstriction. So there are two important ways by which sodium can increase the blood pressure. Therefore, patients of hypertension are given a sodium restricted diet. That's very, very important. They make the endothelium, very stiff because of all these things. So these are the various mechanisms which actually happen. और अगर हम आपको mechanisms पता है, it is very easy to do the drugs. So इसी mechanism पे most of the drugs are going to act. ठीक है? So यही mechanism पे now let's do the drugs, which are going to act, which we are going to study in the subsequent lecture. We are going to do them in details. This is not the actual classification I'm talking about, just based on the diagram, where do the drugs act here. That's very important. So see, the drugs, the most important drugs actually, we have diuretics. So diuretics का क्या काम होता है? Because there is high sodium in the body, it is going to increase the sodium excretion. ठीक है? That is the most important. The sodium excretion increase करेंगे, उसके साथ water भी बाहर जाएगा, so decrease. Water का बाहर जाना is mostly important in CHF, but अकेला sodium excretion is more important in hypertension. So here the drugs which do the better work at sodium excretion, they are the thiazides. Thiazide type of diuretics. So they can be used for management of blood pressure. ठीक है? Then we have drugs which can act on the renin-angiotensin system. So all the renin inhibitors, whether they are the direct renin inhibitors, whether they would be the ACE inhibitors. So यहाँ पे ACE inhibitors भी आएगा, ACE inhibitors और the AT1 blockers, ठीक है? Angiotensin receptor blockers, the ACE inhibitors, again they are going to inhibit the formation of angiotensin 2 and decrease the vasoconstriction activity. That you can give, ठीक है? Then you can give यहाँ पे if we talk about the sodium, because there is vasoconstriction going on, you can give drugs which are directly going to dilate the vessels. So they are called as vasodilators, whether they are the arteriolar dilators, whether they are the venous dilators, or they are the drugs which do both of them. So vasodilators can be given, which are going to increase the vasodilatory process, and that also eases on the blood pressure. Then we have drugs which are going to inhibit the sympathetic activity, right? तो अगर हम ये sympathetic flow थोड़ा सा कम कर दें, so there will be decrease in sympathetic activity, and sympathetic activity क्या किया? BP को high किया है. So आप ऐसी drugs दे सकते हो जो कि या तो यहाँ से ही decrease in the नॉरएड्रेनालिन लेवल्स करें, सो लेस ऑफ द नॉरएड्रेनालिन इज कमिंग आउट, और अगर वो बाहर आ गया सो इट इज गोइंग टू ब्लॉक द रिसेप्टर. सो वी कैन हैव सम बीटा ब्लॉकर्स हो सकते हैं, and because I told you they act on the alpha receptors to cause vasoconstriction, so we can have alpha blockers as well. So these are the drugs which are going to affect. So there are other miscellaneous drugs, but ये major drugs जो हम करते हैं, ACE inhibitors, diuretics, beta blockers और alpha blockers, then vasodilators, then central sympatholytics. These are the major drugs जो हम पढ़ेंगे as antihypertensives. So if you're clear about this pathophysiology, you will have no problem in understanding the mechanisms of the drug. So already I've told you the mechanisms, जो major mechanisms involved है. We will go through those groups one by one and see what are their advantages and what are their disadvantages in different types of hypertension and how to select those drugs. Right? So this is the introductory lecture, and in the next lecture we'll start in details about the drug groups. All right? So take care till then. Again I say, study hard, revise your topics, and be prepared for your exam anytime, anywhere. Thank you.